I'm 23 and my scars are 4 years old. I did my first session of fractional resurfacing. Should I go for a second session? The first pic was before I got my first session of non-ablative fractional resurfacing. The second picture shows how my skin looked after 12 days, and the third picture shows how my skin looked after 20 days. Can anybody kindly give me an opinion on whether my skin is improving or not? If not, can you please specify the faults? Also, my doctor asked me to get 2 more sessions to get the complete result. Should I go for the second session or for some other treatment? Is there any hope?
Thank you for your question. You're 23 years old and you recently underwent fractional laser treatment for acne scars. And you've posted photos where you're at 12 days and at 20 days. And you're questioning whether or not you're getting better and whether you should have the second or third sessions as recommended by your physician. Well, I can certainly give you my opinion about how I approach acne scars with patients your age and other people who have these types of issues. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic reconstructive surgeon, and I've been using lasers and other modalities, including regenerative medicine technology, to help people with acne scars. I've been in practice in Manhattan and Long Island for over 20 years. And I can tell you I've learned a lot about what happens to people like yourself who suffer from the pitting of acne scars. And one of the most frustrating things that patients like yourself experience is lack of happiness with a desired result. Often people are, to say it more clearly, very often it's a frustrating path. People who have acne scars are very often very affected by the presence and the obvious nature of those scars. And although I think people who know them and don't feel that way when they look at them, the person who has it feels very frustrated. And so the problem is that a lot of times patients who have acne scars will bounce from one doctor to another doctor to another doctor to another doctor, and they will use one device after another device after another after another. I think one of the most important things that you have to be sure about is clarity of outcome, and what did you learn when you met with your doctor and you had the consultation, and then what was the expectation? You know, you're posting pictures at 12 and 20 days. This is very early in the wound healing process. Wound healing is a continuum, and when you do a treatment for acne or acne scars, whether it's something like a fractional CO2 laser or any other abrasive type of treatment, you have to go through several phases of healing. There's the hemostatic phase, the inflammatory phase, the proliferative phase. I mean, these are phases that have to do with the process of healing. And so right now, you're still in the early phases of healing. You're in the phase called the proliferative phase. It's the first month after a trauma, whether it's an incision or whether it's a resurfacing. And that means your body's generating collagen. And the intention of a laser treatment is to apply heat to the dermis to create tightening as well as stimulate collagen, thereby improving the overall appearance. And when it's ablative, you're taking off the top layers of skin and with the anticipation that smoother skin will heal over and that there will be an improvement. A lot of times when I meet a patient who has acne scars, I always explain that it's not a single step, and even if whether it's 3 lasers or whether it's a combination. In our practice, we do a combination. Usually, I do things to add volume rather than ablate or use heating devices first. It's not to say that your doctor's approach is not correct, but my approach and philosophy is acne scars require release of the scar tissue from underneath, and then I do a combination of fillers such as hyaluronic acid fillers and the use of platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and what we're doing is we're stimulating the body's own collagen and growth factors to stimulate blood supply and improve the health of the skin. You see, with inflammation from cystic acne, there's actually loss of skin and scar tissue. And so we also do a little procedure called subcision, where placing a small type of fine needle under the skin and release those scars. And then I watch and see how the patient does and then plan accordingly. And I always explain that you'll never get the perfect flawless skin that you've always wanted, but we can take away a lot of the undesirable focal points, the places where the shadows are the deepest or where the scars are more obvious. Acne scar treatment is not usually a single procedure with a single perfect outcome. There can be acne surgery where you actually cut out the scars. And of course lasers, as you've experienced. I think that what you have to have is now, and I'm sure it'll be in follow-up, when you meet with your doctor, talk about how things are going, what to anticipate, what's their recommendation for the timing of the second and third procedure, and what ultimately can you expect. I think if you go in with the attitude that there will be improvement, then likely you will get the benefit from the plan that your doctor is recommending. But if you want to see more than just improvement and you want to see something very specific, then express that and define this with your doctor so that you're both on the same page. This may be a step in a more broad treatment plan that your doctor has in mind, and you may not have had that well established during your consultation. So again, discuss this with your doctor and learn what your options are in addition to the laser, depending on what your ultimate desired result is. So I hope that was helpful. I wish you the best of luck, and thank you for your question.